Now's the time to tell the story because we're coming up to a general election. And it's time for us all to sort of step back a little bit and ask ourselves some hard questions about the future. Hello, my name's David Galler. I'm down here at the Auckland Theatre Company with my friends, and we're talking about Things That Matter, the book that I wrote in 2016, which the glorious Gary Henderson has turned into a play. You can't help but develop a view on the world when you work at a place like Middlemore Hospital for a long period of time. First of all, it's a great place to work. Of all the hospitals in the Auckland region, there's a collegiality at Middlemore, and a sort of comradeship that is quite extraordinary, and it's fabulous. And that's why I think this play is such a good thing. It's a South Auckland story being told in central Auckland. And I sometimes think that for every inch you get to the Wynyard Quarter, South Auckland recedes by a mile. So it's great to be able to tell that story here. Of the richness of that community, the potential in that community to be incredibly successful. So life is quite hard, and people suffer the health consequences of that. And so many of the people who end up in Middlemore Hospital present with complications or preventable complications of preventable disease. And that's a huge cost to them, it's a huge cost to their family, it's a huge cost to that community. What does a healthy Aotearoa look like? Well, there's a real concentration on keeping people well, health in all policies actually. That there is a sort of ecosystem to create wellness within each of our communities and to reduce the kinds of preventable disease that are overwhelming our hospitals and healthcare facilities right now. But actually, if we invest properly in prevention and have got comprehensive strategy to keep people well in their lives, where they live and where they work, our costs in healthcare itself will be considerably less and will be of higher value investment. There's no question about that. Currently in New Zealand, we spend less than 0.5% of the total health costs on prevention, which is a staggeringly low amount. When we know that at least 60% of the population health status is determined by things outside of health, like housing and education and nutrition and all those things. I want audiences to take away from this play a number of different things, but particularly to recognise the richness, the strength and the potential of that population in South Auckland, and how great it would be for them and for all of us if they were to be as successful as anybody else in this country.